What's that white thing called?
Sperm.
Sperms coming in from the
Vagina.
and then going through the passing through the tube, yeah?
Tube.
What's that thing called?
Ovary.
Ovary releasing what?
The egg.
Sperm plus egg becomes?
Embryo.
Embryo moves into the womb and grow into a?
Baby.
And baby when grows big, come up from where?
Vagina.
Vagina again, yeah? Good girl. Hiya, I'm Teoh, obstetrician, gynecologist and fertility specialist in Perth, Australia. I'm back in my home today to do this video. Now this is an interesting video. It is in response to an article written by Nicki Gemmell in The Australian. The article was written with the title questioning whether men should be obstetricians. Nicki stated that she wrote the article to invite discussion. I hope Nicki sees this video and does a follow-up article or talk with a more open approach. Nicki, I hope I can change your mind. Now, in my opinion, the article is written in a biased way. Nicki, you could have included some positive experience of patients with many top-notch obstetricians, both male and female. And there was also a talk about sexual orientation in the article, particularly about gay male obstetrician. No, I don't think this should be in the equation any profession on whether the person is heterosexual, gay or lesbian indeed. Throughout my career, I've seen both very good and bad obstetrician in both genders, in both male and female. I'm talking about their technical and surgery skills, in their decision making and sensitivity and professionalism towards patients. Now let's talk about my personal experience in Glasgow, Scotland. That time my wife and I went through fertility treatment and a complicated pregnancy. I was lucky enough to know most obstetricians in the city, being in the job myself. So I went to both male and female with different expertise at different stages of the journey in pregnancy. So I just wanted the best experts in each different area. In labor and delivery, we had the best midwives, me and my wife at that time, and obstetricians to make sure my child and wife, to make sure they were well looked after. Now, serious emergencies can happen anytime during childbirth. It can be beautiful, straightforward, everything went as planned, or sometimes emergencies can happen which need immediate action to save babies and mothers. Among all those, the last thing I had in my mind was whether the best team involves how many men and women. I just wanted the best team with the coolest head and the best skills to deal with anything. And I think I would like to emphasize that it is wrong in this day and age to presume who is better technically and in decision making based on their gender. This applies to all jobs and all specialties. For example, there are top-notch female surgeons and even urologists who mostly only look after men. And I will have no problem in asking for their help for my own health, for my relatives, and also to look after my patients. I'm passionate about obstetrics and gynecology. The main reason is as an obstetrician fertility specialist, I get to experience firsthand the miracle of what science and biology can do. I'm always a science and biology geek, even when I was a child. I think I have the best job indeed in the world. And I'm able, to nurture cells, a few cells from the body and look after them in the womb, in the lab, and until they grow into beautiful babies. And it's just fascinating. If you see one of my videos of my daughter, she had the same interests as me, even at the age of 4. She went to my office and saw the model I was using to explain to my patients. She started asking questions after questions and had so much interest. She wanted to be a vet or doctor in or biology related field in the future. So I don't see a problem on whether she being a boy or girl or what she wants to do in the future. If she's interested in science and biology, she'll be like me. So even for me, and also for me, even as an obstetrician and gynecologist, I do treat many men, especially in fertility setting, and also some other disease or illness that cause the problem itself. So do you know that male fertility is one of the commonest reasons that a couple can't conceive? Just yesterday, I had just carefully performed a successful microsurgery for a man to treat his fertility. And also, for me, for fertility and pregnancy care, it is a family matter. So I look after family as a team, besides ensuring that the pregnancy is going well while optimizing the women's health. I want to make sure that both the patient, the women, and the partner, it doesn't matter male or female partner, I want them to feel reassured and well looked after. And my own family, my own family have been involved in those years they're tolerating, yes. For me, spending long hours doing research in the lab, it's like living in the lab for a few years, and also all through many, many years, learning and perfecting my skills, and even nowadays, rushing to the hospitals to look after many patients and my patients. My family just prepared for me to leave anything at any time we are doing together. And I just say, look, sorry, honey, I need to go to the hospital. And I'm super lucky. They are so, so supportive of my career and my passion. So in summary, I respect your opinion, Nicki, and I respect that women can choose the obstetricians that they feel comfortable with. It is totally okay. But I still believe there should be an element when we think about obstetricians, we should think, who can make us feel comfortable in making our birth choice, in asking questions, who can communicate best with us at all times during the whole journey, and who is there to look after us when we need them the most at all stages of pregnancies. And my answer for your title is no. This is not the correct. The answer is no, actually. There are many top-notch male obstetricians who should not be excluded in this fascinating specialty. All right, that's me for this time. Bye-bye.